Hi, it's Mark. You know, I'm shaving today because we are going on a field trip, and I'll explain why. Well, first of all, I had the beard because I have kind of a red beard, and Thor, the movie Thor just came out, and he has a red beard too, and I thought, oh, I'll grow a red beard, then everybody will say, oh, you look just like Thor. That didn't really pan out. I've been working out lately. You know, as you may know, I've been trying to lose some weight. Living with HIV is no excuse for sitting on your ass. The other day, somebody said to me, oh, I see you were losing weight. Yeah, I see it right here. That's not good. This is facial wasting. And I used to have pretty moderate facial wasting in the past. And so to correct that, I visited Dr. Gerald Perrone, who has over time given me 2 different treatments. Now, I know I'm lucky. I know it's not very severe, but it is starting, the treatments are starting to fade again. So I am shaving off my beard to give Dr. Perrone, calling Dr. Perrone, to give Dr. Perrone a nice clean palate. So hopefully he'll fluff up my face a little bit. So, see you soon.
We all have the same condition. It's called life. I'm living mine as a gay man and an addict in recovery who's dealing with aging and being a friend and finding happiness and staying healthy and having fun and enjoying laughter, all while living with HIV for more than 25 years. I'm Mark S. King, and this is my fabulous disease.
Hello.
Mark, good to see you.
It's great to see you. Yes, thank you very much. Can you tell me the range that people should expect to pay their physician for the injection, the cost of doing the injection?
Yeah, that's a good point. You know, the big issue has been that Medicare now covers injection of Sculptra and Radius. They cover the physician injection fee for people that have Medicare. But, and this is a big but, there has to be depression related to lipoatrophy associated with it, so that has to be documented in the chart. And the payment, unfortunately, came in too low at $100. So most doctors are not accepting that for the payment. So the typical physician fee for injecting Radius, Sculptra, fillers in general is about $400 to $500. And that's
$400 to $500 for the doctor visit, for the whole session,
for the fee,
not
yes.
per vial. So it doesn't usually happen per vial. It's about the whole session.
Right, though that's for people that get the medication through the patient assistance program.
Okay.
Now, for people that are not in the patient assistance program, most doctors just include the injection fee in the product. So if they do 4 syringes of Radius, they're not necessarily charging a separate injection fee. They're just marking up the Radius over what they're buying it for. Okay. So that's typically what you see in the marketplace. Sculptra typically goes for about $800, $700 or $800 for a vial. And for some with mild lipoatrophy, 4 vials. Moderate, maybe 8 to 10, severe 12 plus. So if you do the math there. Radius, the syringes are 1.5 milliliters, and for mild, 4 syringes, moderate, 6 to 8, severe 10 plus. And the cost of Radius typically, for someone that doesn't qualify for the patient assistance program, I'm going to say $600 to $700, somewhere in that range per syringe. Same idea. What we're going to be doing today, Mark, is a very different technique compared to what we did last time we treated over a year ago. We're using what's called a microcannula. You know, in the past we used a needle to inject fillers, and that's how it's typically done. The difference is a microcannula, the tip of it is blunt. It's not sharp. You know, a sharp needle cuts through anything in its path, so including nerves, small nerves, arteries, veins, hence the bruising and the pain from the injection. With a microcannula, because of the blunt tip, when it encounters a vein or an artery, instead of puncturing it, it'll bounce off and go around it. So much less bruising, and because of the nerves, the tiny nerves that transmit pain, much less painful as well. So I think you'll see a big difference with the microcannula compared to the traditional needle approach for fillers. It's blunt. You can touch it.
I can touch it?
Yeah.
Okay. Oh! Stop. Wow. Okay. Yeah, that just feels...
And it's flexible. And
yeah.
so again...
Well, how do you get that in my skin?
Make a tiny puncture with a different needle, and then through that hole we put this.
You're going to puncture me with a needle, and then this is going to follow up the needle.
Exactly.
And is this going to be one of those things where you're reaching in deep and doing all this with your needle?
And you probably won't even feel it, or you won't know where it is. It really is a remarkable thing. So we'll see. But unfortunately, we do have to start with the needle.
Okay.
You know, to do the microcannula. So, deep breath, and you'll feel a stick. So that was the needle. And we just try to get that over with as quickly as we can. And then through that tiny hole, and this is probably the most challenging part of the microcannula, is just getting it started. There we go. Okay, now there's lidocaine mixed in here with the radius. You'll feel the injection started. And really from this point on, you really should not be feeling much in the way of pain. How are you doing?
I don't know how gory it looks, but I don't feel much at all.
Okay.
I will say this is already less painful than it has been in the past.
Hooray. That's what I was hoping.
I'm wondering if my viewers are really grossed out right now.
Sometimes when we're done with the treatment, people look and go, oh my God, you know, I look lumpy bumpy. Is this going to stay this way? And the short answer is no, it's not going to stay that way. It's part of the body's reaction to the filler. It tends to puff up and become swollen, and then over the next 2 or 3 days it gradually fades and settles down. What we're doing is similar to what we've done in the past. We're doing a combination treatment where we do radius and Sculptra. Now radius we don't massage, but Sculptra we do. So how do we get around that? What we do is we say, well, when we do a combination treatment, instead of starting massage immediately, starting massage immediately, we say wait until this evening and then start your massage. Because by then, radius will set into place, and the whole idea behind the massage is to prevent Sculptra from forming nodules. What I tell people is take your thumb and using moderate pressure in a circular motion, pretending this is Sculptra.
Okay.
That's the degree of pressure we're talking about.
Okay.
And this is pretty typical of what radius looks like after it's injected. When you look, you say, gee, doesn't look natural. It looks lumpy, bumpy, but this is standard. And so anyone who's considering radius and you look like this when you're done with the treatment, don't despair, because this puffiness, and this side we did first, so this side is actually a head, is normal. A lot of people, when we've actually built up their cheeks again, we've restored this volume, then they're going to say, well, gee, now my eyes look sunken in. Now this is exaggerated because of the swelling.
Right.
And that's part of aging. You know, as we age, we tend to lose a little bit of volume there. But
Do you think, because this is my third visit here, that I would be a candidate for doing the permanent facial filler?
Yes. For example, when we finish building up this cheek area after a series of artifill, you're not going to have to keep doing it again. It will be there for the next 10 years. I mean, you'll continue to age around it, but it is a permanent filler.
So you're a fan of artifill.
I
You
am.
think it's something I should move towards, considering I have come back and it's something that I'm pleased with.
Yes. And typically what I like to do is I like to see people back in 2 to 4 weeks to do a touch-up, because it's hard to get things perfect the first go-around, but when things settle down and any bruising goes away, we'll then know in a few weeks whether you need a tweak here or a tweak there. Any questions at all?
I don't. Like you say, I've been to the rodeo before. I'm
Okay.
good. Thank you very much.
Very good.
Hi, it's Mark, and it's been about 1 month since I had the procedure with Dr. Perrone, so I want you to be able to get a very good look at this as to what's going on with my face. Obviously, I still have my acne scars, I still have my wrinkles, I still look 50, but what we're trying to correct here is the actual facial wasting. And if you were to look at me from 2 years ago when I started this procedure, you would probably see a big difference. Let's review some things to keep in mind about all of this. Number one, be sure to locate a doctor that has a lot of experience in this. This is your face. You know, there are a lot of facial filler outfits cropping up all over the place. They're doing it at gyms. They're doing it in the mall. Not for me. I'd rather do it with a doctor that has real experience in this. And secondly, be realistic about what your expectations are, what you hope to achieve through this procedure. And then finally, I think that I am going to go ahead and explore the idea of doing the permanent or semi-permanent filler. The woman there that I was talking to, the idea that I don't have to keep going back, that the expense doesn't have to be repeated, that the needles don't have to be repeated. I think I trust Dr. Perrone and I trust this procedure enough that I think I'm ready to save my pennies, and maybe next time this is needed, that I need a fluff up, that I might look into the permanent filler. So thanks very much as always for watching, and please be well.